Welcome to the Cutting Edge Health Preventing Cognitive Decline podcast. I'm Jane Rogers. Welcome to today's episode of the Cutting Edge Health Preventing Cognitive Decline podcast. I had the pleasure of interviewing Dr. Sandeep Kapoor. He has Kapoor Medical. It's in Los Angeles. And he's a geriatrician. He specializes in internal medicine. He's a functional medicine doc too. And he really is passionate about preventing cognitive decline. And one of the ways he does that is with genomics. He's an expert at analyzing the genome and deciding what can we do so that you don't get Alzheimer's, even if you're homozygous for the Alzheimer's gene. So I hope you get as much out of this interview as I did. Dr. Kapoor, thank you very much for being with us today.
It's a pleasure to be here. I'm really excited about it.
Yeah, I'm excited too. So we interviewed someone who I was so impressed with, Sharon Hausman-Cohen with IntellxxDNA. And she said you are her all-star doc when it comes to genomics and how to interpret those so that we don't get dementia. And so we live a healthy lifespan from other age-related diseases. You have a big patient population. Tell me how you do this and what your thought process is.
So I enjoy cutting edge information. So I met Sharon at a conference about 4 years ago and was really captivated by her lectures about genomics and genetics. Previously been kind of scared of genetics. That was a geneticist's role. But when I found out the application of genomics to real life medicine and how it could actually change people's lives, I became an immediate student, and I got involved during the pandemic with Sharon and her group, and went to several remote lectures and did many different things to get educated. And now I am proudly part of the faculty teaching other doctors how to interpret, how to basically change the way we look at cognitive impairment, cardiac disease, diabetes, in hopes and understanding that there is something we can do about these chronic illnesses that plague our whole society. And previously, as an internist and a geriatrician, I had medications, that I could prescribe, and I was very adept at doing that. But I didn't always have the great outcomes and results that incorporating other factors of lifestyle and nutrition play into the role of how you shape and prevent illness. So that's how I got interested in it. And it's been ongoing research and ongoing learning.
Excellent. And you were telling me earlier, you don't only see people who are in their 60s, 70s, or 80s, who you would think would be the cognitive decline population. You're seeing people as young as 35 saying, whoa, wait a minute, I can do things now if I know my genetics that can help. So I am not getting that.
The real process and the understanding is that things really start to go wrong, 15, 20 years, sometimes even more, before the onset of any memory issues and concerns and decline. And also, there has been more you can do about it. So therefore, that's the knowledge we need to impart on people so we get more people interested in their brain health when they are younger, because you live a certain lifestyle. If you live a certain way and take care of yourself and do all the things for your cardiac health and your other parts of your preventative health, then you ward off the chances and the way of being able to express disease. And so I think knowledge is power. I think it's a big thing to impart on people, that the more knowledge we have, then we get less afraid of it. And the tools that we have give you actionable resources, actionable things and ideas to do for you that are personalized. That's the key too, is that each person has a different trajectory towards any kind of illness, including brain health and cognition. So sometimes it's based in family history, and sometimes people are afraid because they have, everybody in my family ended up with having Alzheimer's or dementia, and they're afraid, and and they want to know what their risks are and how they can avoid them.
So what do you tell them? What's the first thing that your toolkit will provide?
The first thing I tell them is to not be afraid, right? So it's the first gene, and everyone knows about. It's called the ApoE gene that has been famously called the Alzheimer's gene. And I even myself used to be afraid of checking it like 20 years ago because it's been around, because I didn't really know what to do with it. But now I really think people should know what that status is. But the first thing I tell people is that what I do is figure out what the risk is. And then I tell you, here's the roadmap to steer around it. And that's the most to steer around it, or involve yourself in prevention. And what do you specifically need to watch out for? And that's what I say. So getting rid of the fear, I think, is the first step. And being a happy, meaning approaching it from the standpoint that this is going to arm you with the tools to be able to avoid it.
And I was just like you 20 years ago. I wanted to know, but I was scared, because was there anything really we could do if we had the Alzheimer's gene? And now there's so much that can be done. So before we get on to what can be before we get on to what can be done, tell me about the genetic testing. So can I just do 23andMe? Do I need to do something as extensive as IntellxDNA? And what will that provide me if I make that investment?
So 23andMe is sort of, I would say, like the scraping of the surface and the sort of the X-ray, if you will, of like the genetic world. And something like IntellxDNA is where that's the MRI, that's the super imaging that you get, because it tells you every detail about and it's very accurate, and it's very it uses next generation sequencing. So there's much more depth and involvement to understanding the genetics in relationships. So when I look at someone with cognition, the genetics, I start with, there's an ApoE, there's that particular gene, but that affects over 1,700 other genes, either turning off or turning on genetics. And it's influenced by cognition's influenced by 200 or 300 directly, which are established in there. So when it comes to how your body manages sugar and how your brain manages glucose and sugar and metabolism and cardiovascular and blood vessels. And so I look at all of it. I initially went to do the genomics and the genetics with IntellxDNA, being only, sort of saying, well, I just want to do the brain panel, right? Or what is the brain health and the cognition panel? And I came away from there going, well, I need to also look at other things that happen in the body, like detoxification. How does that happen? And also other environmental factors, and what does this have to do with, what does inflammation play a role? So everybody understands what inflammation is. They can understand that, and the problem exists is when you have chronic inflammation and you're not really just getting a blood test and letting you know that that's there. And what are you at risk for when it comes to inflammation? So those are why the IntellxDNA has been so profoundly deepening in sort of my understanding of how the body works, how the different systems all work together to serve the brain or to serve your blood vessel system. So I can't do it without all of those different panels. And the key is looking at patterns that are unique to certain individuals. And those individuals, we teach that person, this is your unique book, this is what you have, and this is how to steer around it. I had a 35-year-old woman, she was 32, and she wanted to know everything. And it turns out she had 2 copies of the ApoE4.
Ooh.
So that means that she was what we call homozygous, or she had 2 copies, and that makes her have a lifetime risk that's very high for Alzheimer's over her lifetime. But she didn't, she was about to get married and, have a child. And, because we had the entire, what we call the powerhouse, or the entire look at everything from mental health to diabetes to cardiovascular risk and her estrogen patterns and all of that, I was able to really have her come away with some profound reassurance that she will never have to express that ApoE44, that double copy, because she asked me if I'd be around 30, 40 years. And I said, sure, well, let's do this as a case study, so we can follow you, through her life. And I said, I absolutely would love to do that. And that's the idea of longevity. I have to be around to help these people. But she came away with an empowered sense, not something that goes, oh my gosh, I should probably not get married because when I have kids, I'm going to pass on some bad genes to them. And that's the beauty and the power. And so she ended up becoming a patient of mine too, as a regular part of my practice, because I guess I know her really intimately, and I helping her with her. She's now pregnant, helping her with nutrition and pregnancy, because the key is that the other doctors, they don't have time, they're just making sure the baby's okay. So it becomes a relationship sometimes with these patients. And so that's an example I use because it's very I had no idea that she would have 2 copies, and I also took care of her one of her parents, so who has only one of the genes. So you start to look at both generations and you can figure out a roadmap. So from her mother's 75 and she's 35, she has they have some mixed genes and things like that, but it's very different for somebody who is in their 75, what we would do in someone who's 35, right? So we just pivot between the two.
Should we go into what you might do if someone is homozygous for ApoE4 at the different age spectrums? What would you do? What would you recommend right out of the gate?
So if someone's ApoE4 has 2 copies of that, I would really start to look at all of the areas that go along with it. Like, so if they're older, like an older woman, I would make sure I probably approached estrogen, and I would approach hormones and hormone support, trophic support, start looking at other there's mitigating factors too that are discovered in the genetics, and powerful mitigating factors. And we would just start to harness one by one, make sure the patient that they're methylating correctly. What are the other things that are going along with that ApoE4? For example, there's a substance, there's a genetic gene called tumor necrosis factor. That sounds really bad, but it has to do with inflammation, and it has to do with, and if that's in combination with the ApoE4, that can also wreak havoc that can wreak havoc and increase the risk of expressing that. So what I would say is then I would start interventions on really beating down tumor necrosis factor with things like lion's mane mushroom and ashwagandha. The different natural substances that exist. I also would look at lipids and cholesterol and try to figure out vascular risks. And I would probably put that person on some kind of a nutritional plan that met the needs of the right glucose metabolism or sugar metabolism for their brain, and likely put somebody on a keto, kind of a mild ketotic diet, intermittent fasting. So there's a lot of nutritional aspects that I would do. And obviously it depends on who, if they're expressing any of the cognition issues, if they are older and they have that and they are expressing some issues, or they have inflammation, they have these, we'd need to do more testing. We would do more testing, and there's more testing available, like looking at blood tests for the degree of amyloid production in the brain. Now there's new blood testing for that. So what does that mean? Amyloid is a protein or a substance that we understand to be part of one of the causes of brain entanglement. So too much of that protein building up in the brain can lead to cognitive impairment. So previously, we only had ways to take cerebral spinal fluid or do a spinal tap to really try to see how much amyloid you have or what's going on in the brain. Now we've developed these really quite amazing blood tests that people can get to look at if they have the amyloid burden. And there's another protein called tau, Tau, that is also responsible for cognitive decline. So that's now a new test that's available too. So the approach would be age specific or what they're currently meeting them where they're at. And, but really putting on the, I have another woman who is in her mid 50s and she's an ApoE44 who really has she is not expressing any, she's an attorney, she is not expressing any cognitive decline. She's a mother of young twins. So but she has a weight issue, she has metabolic syndrome, she has a lot of inflammation. So the focus for her is to really get the weight off, to be able to get her metabolism, get her hormones sorted out because she's postmenopausal, get her on a hormone regimen, and have her engage in a real lifestyle change. Because her father, who is also my patient, is also a 4-4, very interesting, he's in his mid-70s, is expressing a significant mild to moderate decline. So there's also that part of like, well, I can sort of see the writing on the wall, but I don't have to, because he also is improving in a lifestyle program. And so he's immersed in that program in a residential community, yes.
Do you find that if people make the investment, and it's an investment to come to someone like you in private practice and insurance doesn't pay for it, if they make the investment, are they motivated to make the changes that really have to happen?
I mean, I think it's important. I mean, yes, this is a out-of-pocket expense, but it's also the expertise of trying to figure out that it's one tool, but they really have to meet me and be motivated, because I can give them the passion, I can show them the way, but I'm not going home with them and cooking their meals. But I do think that each person, we can find the strengths. Not everyone can hire a chef to do or think, wow, this is really difficult to do. So we have a coach. I actually work with a coach and nutritionist within the practice, because I realize that it's not only one person that can implement this. I mean, so part of it is absolutely, you're right, the motivation needs to be there, and it can't, and they need to have a champion too, like it doesn't have to be a spouse, so it could be a child, it could be a friend, it could be someone that is on board with really believing. And it's a belief system too, that because it's so devastating to tell people that there isn't a whole lot you can do. And that I find in the community, in neurology and in my own community, that is what most people are told. And I'm in Los Angeles, and we have great healthcare, but when it comes to the area of cognition and mental, and Alzheimer's and these words that are buzzed around, it is basically, well, here's some medication, perhaps might help you, but essentially, you need to start planning for decline, which is really, in my opinion, not. I'm shouting from the rooftops. That's the other key, is that, I am one person. So that's really where my expertise in actually teaching other primary care doctors, other neurologists, and people who see geriatrics or geriatricians, people who see a more preponderance of older patients who are much more vulnerable to this.
Why aren't there
in
more
their 50s, 60s, and 70s?
Why aren't there more geriatricians in this country?
Yeah, I'm only one of, I think, 7,000 board certified geriatricians, and it's it's really scary how they're not turning him out. I think it's just unpopular because of reimbursement, Medicare, and the time it takes, really, because it does take a lot more effort and time sometimes to deal with the woes of aging. And, I have been doing this 25 years, and it has been a journey, in how we take care of our older people. And I don't really have a good answer for that because we're just not incentivized. Primary care physicians become geriatricians by default because their patients age with them. So what happens is, but are they really looking at the research? Are they really looking at what it takes to be a geriatrician? And which means dealing with all of it, from heart disease to, in a way that is not only about medication, and that becomes too many medications can do a lot of harm and decline. And so we have a big undertaking in this country.
I can tell, though, you get a lot out of this specialization, a lot out of it, and you're loved by your patients. It gives back as much as you give.
As a healer, as I've evolved from being a physician only, and that's partly because of my interest in functional or integrative medicine, has evolved me as a healer. And so, yes, part of what the healer gets is back. You get back. You get back the joy, and it's not financial. It is a deeper heart healing that keeps me passionate and fueled, because it's still very much a broken system. And if I was, people say, well, why do you want to work with older people? That's kind of depressing and boring. And I'm also a hospice doctor, so I'm very skilled at understanding end-of-life care, which makes sense if you're a geriatrician. Why wouldn't you also deal with death and dying, which I do? But it is a very hopeful, I give people hope. I give people faith. I say to them that it's about the human condition and suffering and not suffering. And that's what I bring to the table. And it gives me back so much to me as a healer. So that's that positive feedback. Mm-hmm. The gratitude, when you see somebody improve, or you see somebody who has brain fog and they come to life with certain changes that you've made, or they are they're happy, they're laughing, they're interacting again with their family and their spouses in a way that is so meaningful and so wonderfully. Those gifts you can't measure in any amount of. It is just wonderful, and that's what fuels me to keep going.
So we talked about some of the tools that you use to help people. You use the genomics. You use a lot of lifestyle things and the testing and the diet, and I'm sure exercise is in there too. What else might we be missing as a component that you say, oh, this is really important if you do this?
So I ask, every time I have a visit with a patient who has cognitive decline or any part of it, I'm always asking, what we look at their nutrition. We say, how are you doing there? We look at exercise. Mm-hmm. We also look at mind stimulation and ask them if they are doing something, even if they're working and say, well, that's where I'm getting my mind stimulation. And that's not always the case. What are you doing that is creative in your head? Let's say you have a non-creative job. Like, what are you doing for your mind? Are you doing puzzles? Are you doing certain brain games, or things that people consider like, well, I don't need to do that because I'm like an executive or something like that. But I said, well, you got to do something different. You got to find a passion or hobby. So brain stimulation is one big key. We also ask a lot about stress and mental health. Mm-hmm. So stress plays a huge role in what we understand and do, and beyond the life stresses of that are out there and in the world that definitely impact us day to day. But it's also just understanding fear, anxiety, and worry about aging, or about what's going to happen and the what ifs. And so we deal with that. And there's also other life stresses. There's family stress. There's different There's financial stress. So these impact our physical being and our mind so intimately that it can actually be, and sometimes I look at people's genomics and their inflammation markers that are caused by stress. I mean, you could actually raise a level of this certain kind of inflammation molecule in your body simply by having stress, not by having an infection or by having other things that we see. But there are key elements that we find out that are unique to each person. So I think mental health plays a bigger and bigger role in our cognition and our cognitive decline. And, I think that's very important to pay attention to when we are looking at someone with either preventing memory or understanding what cognitive decline is.
Mm-hmm. There's a researcher at UCLA who I had the pleasure of watching speak at a Increasing Health Span Summit, a longevity summit just recently. I think his name is Matt Lieberman, and I think he's a neuropsychologist. He was saying, it's so fascinating. What will lead you to a longer health span? Well, smoking isn't going to be helpful. And you know that has high mortality rates. But even worse, he says his research is finding, worse than smoking is loneliness. And I was amazed. Social isolation and loneliness. And that plays so much into Alzheimer's, too.
Absolutely. We need to really harness these our neuropsychologists and our psychologists who point this out. I mean, it is what happened during the pandemic. There's a reason why we have a real rise in our diagnoses, actually, or just of Alzheimer's. And in the last year and a couple of years, I'm super busy on that part because the stress, the isolation, loneliness. What did we do during the pandemic? We told our senior, we were all saying, well, gosh, we can't go over there today. I can't go see my parents because I might kill them. I might give them COVID and then they might end up. So we did that because we wanted to sort of save them or isolate them for purposes of infectious disease. But what ended up happening is that we created that social isolation, even though we weren't intending to do it. And it became, it really wreaked havoc and caused a lot of the cognitive decline to accelerate. And some of the treatments that I did actually for some of my own patients who didn't have any pre-existing cognitive decline, when I saw their isolation happen, nice big family, but they were like, well, mom has to be isolated because we don't want to give her to her. She ended up seeing things on the wall and thinking that bugs were invading the house and all sorts of stuff. And it turned out, her real impetus was being socially isolated from her children or grandchildren. And I actually organized a whole, thing where she went down to her son's house in Orange County and spent some time safely outdoors with her children and her grandchildren. And lo and behold, it started to live. She didn't see bugs anymore. So even that one organization of that family kind of reunion, if you will, brought her back. So then we decided to keep that going, So it's in terms of like isolation. So a quick example of how you're absolutely walking down the right path. Isolation, social isolation, big risk factor for cognitive decline.
Mm-hmm. I think it is, and it's just epidemic right now in this country. So if somebody wants to become your patient, because there are only 7,000 of you in the country, and you are very good at what you do, honestly. So what do they need to do that? What kind of financial investment is to be expected?
Well, sometimes there is a patients that are local, I do take them on a case-by-case basis. So sometimes they come on board as a regular patient. Mm-hmm. So it varies. And so it varies from memberships, depending on age. From $5,000 a year as a membership. So it's part of the membership upwards, depending on their, because I have a very small practice, so I have under 300 patients, so I keep it very tight. And so because I spend a lot of time with each patient, at least generally an hour visits or whatever time people need. But there also is a way to do consultations with me that are not part of the membership. So that's great too, which involve the genomics or understanding. They get the whole genomic kit. And those range from including all the kit and all that, somewhere from two to 2,500 or 20, something like that. I'm not sure quite of the number, the numbers there are on my website, or if you contact us, we can give you more specifics or what you might be needing. What I try to do for each and everybody that is, and I not try to do, I do it pretty much every time, is I give a little bit of what we call a little visit or a complimentary kind of a 15-minute thing where we kind of talk about whether or not I'm a good fit for you. So, meaning that if it's whether it's remote, because I also I can do things remotely for people depending on what their situation is and what they need. So each person is individualized the same way I individualize every patient. So that's kind of like they come to me and we just basically I have a coordinator who basically tells me, because the purpose of what I do is whether I'm the right fit or not. I mean, it depends on what, there's a lot of information out there. That's the other thing too, is that people are doing things for cognition, and Dr. Dale Brederson's work with Apollo Health is something that I am very heavily in support of, and because there are a lot of people out there doing the work of Dr. Dale Brederson, who is the renowned neurologist who has created an answer to the reversal of cognitive decline and written several books, and is still charging forward with research in the area of what we can do differently and better. And so it is growing. It's a growing environment. So for me, it's about spreading the word. I do my best to meet everybody where they're at, so that I can determine whether or not, or identify somebody actually in their local community, point them in the direction. I'm happy to do that too, because it is it's a very niche. What I do is very niche. So I pour a lot into it beyond even some of the consults. People say, well, my gosh, and they end up becoming patients, because I'm also a primary care doctor. I deal with cancer and heart disease and diabetes and weight loss and weight gain and blah, blah. So I wear a lot of hats. So,
So if you were to wave a magic wand and change the medical community, Western medicine is sometimes struggling. You're different in that you use a whole lot of modalities. You use the lion's mane mushroom, you use a lot of different things. It's not just medicine. But how would you retrain American docs? They're busy. They've been through a lot of training. What's the future?
The future is again spreading the word and realizing that whoever's on the front lines, and it's usually whether it's pediatricians and primary care, obstetrics and gynecology, they just have to be sort of just motivated for a change, and a lot of them are burned out. And I like what you were talking about earlier about the feeling of healing, or what does it give to the practitioner to be able to help these people. That's what I want people and other doctors and practitioners and nurses and health coaches and people who are in the medical world, nutritionists, all of those people, they're in pockets around everywhere. And we just need to be able to join together and say, hey, there's another way to actually, for you to feel better or feel like you're actually doing something with or making some changes versus running in and out of rooms every 10 to 15 minutes. It gives you back so much more for your own life. And also, I think learning about how the practitioner's own self, right? I did my own genes too when I, after a little while, because I wanted to figure out how to read them or how I learned from Sharon first, but I did them. And so it's really self understanding that we're as healers, we're human beings, and we're part of that that mentality. So you're human. So understand that that's how we change Western medicine. We become part of the solution, which is to engage in ourselves and self-care and looking at what I can do to walk the talk, right? I can say a lot of things about eating and nutrition and working out and exercise. And I'm a very busy person. But, I got to get on the rowing machine every morning because it's not only for aesthetics, it's really for my brain.
Mm-hmm.
I realize that I need to have a jolt of high intensity intermittent exercise, and it's only 10 to 15 minutes. But if I do it every day, I'm going to get that brain boost. So it's really about learning what you can do as a practitioner for yourself. And it's not selfish, it's really about self-care. And then you're ready to tackle and say, hey, look, I can, I use myself a lot and say, well, I'm really busy. As you can, I have kids and I have a life and I have my parents I'm taking care of and all this. But I still have to take care of number one before I take care of you or anyone else.
Mm-hmm.
So that's really where I think the future.
Like when you're on the airline, they say put your mask on first and then help your child. You have to take care of yourself.
Exactly, yeah. And it's a hard thing to learn for people that are gung ho, and we're like in the medical community, we're just we're always we're type A and we're going, and we're sacrificing and saying, well, residency and all of these things make you a driven person, but you realize that you lose the way at some point, that you lose the way and you start aging yourself and losing it. So I think that pointing it back in a direction, that's how I got inspired by going and actually speaking to, or actually sitting in a conference with Dale Brederson speaking almost 8 years ago, and just seeing and hearing him. At first I thought he was brilliant, and I'm like, wow, I can't do all that. What is he doing? But I was intrigued, and I was actually at that whole conference was a functional medicine conference, and it was focused on the brain. So that was like, but it was all areas. It was OB-GYNs, talking about estrogen. It was a lot of different practitioners. So that was what inspired me. So I encourage people, I encourage practitioners, I encourage to start to look. There's seminars everywhere. There's online stuff. There's to get involved.
And part of the responsibility, I think, falls on the patient. So your practitioner gives and gives and gives. I think it's very important as a patient to ask them how they're doing and thank them for their time. And really, how can we support you? Because it's a two-way street. It's not, you can't give all the time. And patients need to step up and give back.
And I think they do. I think once you open up the world of being a person and a human, that the patients respond so well to that. They know that you care. And once they feel that, they really, they give back. How are you doing? How are your kids? That even it takes 2 minutes, but they are stepping up to play. And that's part of their own motivation. When they see you're motivated, I think that it sort of mirrors that. And then they realize that, oh, well, if he's doing it, like maybe I can. And the question of meeting people where they're at. Yeah. So empowering patients to do that without even actually, it's sort of a psychological thing. You try to engage them that way. So I think that's a good thing.
You're able to practice in other states? Consult?
Currently, I am not licensed. I'm looking for licensure in different other states. But how we work that with is we provide we do consultations with that, and then we do it with their. So we require them to have primary care doctors generally there locally to be able to implement that. But so we're able to do it with without necessarily. They have to have the information distilled medically with their primary care.
Great.
Until we decide to get licensed. Yeah.
Dr. Sandeep Kapoor, how do people get a hold of you if they're saying, I want to learn more?
The best way is email through info@kapoormed.com. So info@kapoormed.com. That's the best way to get a hold of us. And we'll might have a great coordinator who will return that email, and will really be able to provide the information that they need to see if we're a good fit.
Excellent. Dr. Kapoor, thank you for your time. This has been such a pleasure.
And thank you. I know it's been long in the coming, so it's been so busy, but I'm really happy we did this, and I look forward to more and more information that we can share with the public and with everybody, because we really, really need to get the word out that there is something we can do about preventing cognitive decline and reversing it and treating it in early stages. So we're excited to join with people like you who are championing the way through this whole process. So I really appreciate, and I'm honored to be on your podcast with you.
Thank you very much. You have a great day.
All right. Thank you. Take care.
You've been listening to the Cutting Edge Health Preventing Cognitive Decline podcast. Any information shared here is for educational purposes only. Guest opinions are their own. This podcast is not responsible for the veracity of their statements. Do not use any of this information without first talking to your doctor. Cutting Edge Health, LLC, is not responsible for what may happen to you if you use their information in place of official advice from a medical professional. Thanks for listening. Be well.